The most important part of the prenatal course is that serial evaluation from a provider. So it's a series of appointments and they happen at a certain period in time, and as you get closer to delivery, those appointments get closer and closer in occurrence. The most important part of that process is for the provider to ask mom questions and to assess whether or not there's any developing complications potentially, anything that's going to put mom in that high-risk category. When I'm looking at the records, I'm looking to see if there were missed opportunities to recognize a high-risk pregnancy. High-risk pregnancies do require a totally different plan of care in that last trimester. Moms are typically going to have more frequent visits. They're also going to be having some antenatal testing. They're going to be doing a closer surveillance on how that baby is tolerating the pregnancy. Moms may be going to the doctors twice a week to get an NST. You'll hear that term. It's a fetal non-stress test, and really they're putting the mom and the baby on the monitor to see if mom's having any contractions, but more importantly, how the baby's heart rate is responding to that pregnancy. So they're going to keep mom on the monitor at least 20 minutes, 30 minutes typically, and they're going to be assessing and evaluating whether the baby is tolerating the pregnancy. When I'm looking at the urine samples that everyone leaves at the visit, we don't always know the importance of it, but that is an important part of the record. If mom is having a positive result in her last trimester and she is having protein or glucose in her urine recurrently, and that's not further evaluated, that could be a sign that something's happening. When I'm reading the records, I'm reading that whole story. It's important that we educate and we empower people. We want people to know kind of what to expect, but also to ask questions.